Social media has revolutionized the way people communicate and share information online. With over 3.6 billion people actively using social media worldwide, its impact on mental health has become a growing concern. While social media has many benefits, it can also have negative effects on mental health. One of the primary concerns regarding social media is the constant comparison that takes place. Users are constantly bombarded with images of other people's lives that seem perfect, leading to feelings of inadequacy and low self-esteem. This can lead to negative mental health outcomes such as anxiety, depression, and even suicidal thoughts. Another issue with social media is the constant need for validation through likes, comments, and followers. This can lead to a lack of self-worth and an unhealthy addiction to social media. It can also create a pressure to present oneself in a certain way online, leading to a lack of authenticity and an unhealthy focus on image and perception. Furthermore, social media can contribute to a sense of isolation and loneliness, despite being connected to thousands of people online. Studies have shown that excessive use of social media can negatively impact sleep patterns, leading to sleep deprivation and fatigue. This can also have a negative impact on mental health. Social media can also contribute to cyberbullying, which is a growing concern, particularly among young people. Cyberbullying can lead to anxiety, depression, and even suicide in extreme cases. However, social media can also have positive impacts on mental health. It can provide a sense of community, particularly for people who may feel isolated in their daily lives. It can also offer support for those with mental health concerns, allowing them to connect with others going through similar experiences. It can also be a useful tool for education and awareness raising about mental health issues. In conclusion, while social media has many benefits, it is important to be aware of its potential negative impacts on mental health. Users should be mindful of their social media use and limit their exposure to negative content. Education and awareness raising about responsible social media use can also be helpful in mitigating negative mental health outcomes. An example of the impact of social media on mental health can be seen in a study conducted by the Royal Society for Public Health in the UK in 2017. The study surveyed nearly 1,500 young people aged 14 to 24 and found that Instagram had the most negative impact on mental health, particularly in relation to body image and self-esteem. The study found that Instagram's emphasis on filtered images and perfect lifestyles can contribute to feelings of inadequacy and low self-esteem. It also found that cyberbullying and the pressure to present oneself in a certain way online were significant contributors to negative mental health outcomes. However, the study also found that social media could have positive impacts on mental health, particularly in relation to providing a sense of community and support for those with mental health concerns. This study highlights the importance of being aware of the potential negative impacts of social media on mental health, particularly for young people who may be more vulnerable to its effects. It also highlights the need for education and awareness raising about responsible social media use and the importance of seeking support when needed.